So we started the SignTalk project almost a year ago, and we spent most part of last year doing a review of literature so we can understand the scope and then know the contributions that have been made in this research paradigm. We also spent most part of last year doing community-based feasibility studies and stakeholder engagement, just so we can understand what the speech and hearing impaired folks in Ghana really need as an intervention in their communication. Now, we have realized that most speech and hearing impaired people visit the hospital and they have the challenge of communicating properly with the physician. We also know that some speech and hearing impaired people are able to hire translators, but for most of them, hiring a translator is very, very expensive. So in this SignTalk project, our objective is to bridge the communication gap between those who are speech and hearing impaired and then physicians. We do not want to widen the scope, but we are starting with accessing good healthcare and being able to reduce mortality rates due to medical errors and so on. And so what we have done so far in this project is that we have gone ahead, after doing community-based feasibility studies and a good literature review, we have gone ahead to build some sentences, generate some sentences. We have generated more than 4,000 sentences that are primarily revolving around interactions between health workers and people who are speech and hearing impaired. With the available sentences, we needed to get them signed. And so, first of all, I must note that we have existing data sets of Ghanaian sign languages, and all that we needed to do was to extend it. And so we recruited 5 qualified signers from KNUST's Disability Studies, and these signers are to actually help us extend the existing data sets by signing the generated sentences we had. And so we engaged these signers for about 4 weeks in a very well-equipped studio, and we got them to sign all these sentences in about 3 steps or sets of variations. So far, with the help of these signers, we have about 10,000 video data sets ready and available. These 10,000 video data sets have been correctly labeled, and they have been validated again with the help of these sign language experts. So going forward, we are looking at a parallel approach. We want to make these data sets available to the public, and especially to Ghanaian AI enthusiasts and AI experts, to work along with these data sets to build wonderful sign language models. So what we are looking at is Ghanaian sign language translation. We are looking at the situation where you can have a camera feed or upload a video of a sign to an AI system, and then the system can translate your sign into text or into audio. So our hope is to make these data sets available and run an innovation challenge to invite students and other AI engineers to work with this data set to generate a model. That's going to be one part of our parallel approach. The other side, we as a team on this project are also currently working with the data sets that we have, so to see how we can arrive at a very good Ghanaian Sign Language translation model. And we believe that with this model, we can help a lot. We can create an intervention that will become extremely useful for people who are speech and hearing impaired, especially in closing their communication gap at the health facilities. Now, I think of this in these ways. I believe that when we are successful, then we have actually contributed to inclusivity, to promoting inclusivity, and then also to improving access to healthcare, and finally we have reduced mortality rate. We are working as a team. I am serving as the leader of the team, but also I have with me Mr. Richard Adade, who is a Ghanaian sign language expert, and then I have recruited about 2 postgraduate students and 1 undergraduate student, all on this project. I also have with me Dr. Kwabna Owusu-Adjumai, who is also an AI and ML scientist, all on this project. I want to say a big thank you to all our funders and partners in this project.